Hello and welcome to our newest Synutra Pure Blog series. In this series, we're going to revisit a topic we've touched on before, supplements and joint health. Supplements are an excellent way to enhance and support self-care routines while exploring the best management option for you as an individual. And supplements for joint health maintenance are just one aspect of many people's routines. This week, we'll be focusing on joint health and supplement options, opportunities that are being studied for their potential in joint health support, but know that supplement conversation is one you can have with your doctor for any number of needs. With that said, let's jump on in to cover our 5 joint health supplements. Before we get into our overall list, let's do a quick rundown of what we're going to be looking at. There are many joint health supplements on the market, each with different researching extolling the potential virtues of each option. The options we are going to be focusing in on are vitamin D, glucosamine, chondroitin sulfate, Methyl sulfonyl methane, or MSM, and turmeric. These are all supplements actively studied for their potential impact on joint health, and all are relatively simple to find online and at stores. Number 1, supplement, vitamin D. Vitamin D is a supplement recommended for many health maintenance routines. According to research, vitamin D supplementation is less about enhancing vitamin D levels past normal for positive impact and more about making sure vitamin D levels are at normal levels for your size and age range. There is little evidence that vitamin D directly combats osteoarthritis, but there is some research that using vitamin D supplements to make sure your levels are correct may have a slight impact in alleviating joint pain. We are beginning today's conversation with vitamin D because while the research is inconclusive on its impact on joint health, it focuses on making sure your vitamin D levels are where they should be. Whether or not it supports joint health, making sure your levels are right can impact your life positively in other ways. Vitamin D is necessary for the absorption of calcium in the bones, supporting bone health. And we all know calcium supports bone health. Vitamin D also supports cellular function and provides anti-inflammatory, antioxidant, and neuroprotective properties that support the immune system, muscle function, and brain health. So as you can see, while vitamin D requires further study to be able to speak conclusively about its specific relationship to joint health, it provides enough other positives that it's worth trying out. Join us for part 2 of our series tomorrow as we discuss glucosamine and aspects of chondroitin sulfate. Welcome back to part 2 of our series 5 joint health supplements. We'll start things up with a supplement number 2, glucosamine. Glucosamine is a commonly recommended supplement for joint health, often seen in some sort of combo of chondroitin sulfate and glucosamine. The neat thing about it is that it's a compound naturally found in cartilage. For its supplement form, it is typically either lab-made or harvested from shellfish, and in its glucosamine sulfate form, the compound generally recommended for osteoarthritis. It is considered generally safe. Research on glucosamine is mixed. If it wasn't, there would be an arthritis drug on the market instead of supplements. But scientists have looked at oral use of glucosamine sulfate in patients dealing with osteoarthritis of the knee. One of glucosamine's other forms, glucosamine hydrochloride, has also undergone research for its potential impact in managing rheumatoid arthritis. The difference between glucosamine forms is important to note, as the forms are not considered interchangeable in what their recommended uses cover. When using glucosamine supplements, make sure to keep an eye out for minor side effects like heartburn, nausea, diarrhea, and constipation. Additionally, talk to your doctor before introducing glucosamine to your routine, as there may be potential interactions between glucosamine and acetaminophen and glucosamine and warfarin. Supplement number 3, chondroitin sulfate. Chondroitin sulfate is our next supplement, and as we said before, it is one commonly seen in a combo with glucosamine. Chondroitin sulfate is a compound that can be found in the cartilage around joints in the body. It is most commonly manufactured from animal sources such as shark and bovine cartilage. Companies make chondroitin sulfate using a variety of source materials such as shark, bovine, or avian cartilages. Researchers have investigated chondroitin sulfate for its potential to reduce pain, increase joint mobility, and decrease need for painkillers. The research results are mixed, and further study is needed before hard benefits can be stated, but we do know that chondroitin sulfate has been deemed safe in the right doses. Due to the fact that there are relatively few side effects and is generally deemed safe, industry experts generally support its use in patients with joint health concerns, particularly in osteoarthritis patients. Join us again next week for part 3 as we finish discussing chondroitin sulfate and move on to MSM. Thanks for coming back for part 3 of our Synutra Pure Blog series, 5 Joint Health Supplements. Today we'll be starting by continuing the conversation about supplement number 3, chondroitin sulfate. Like the other supplements, chondroitin sulfate needs more research in the U.S. to be able to elaborate further. For the moment, however, its level of safety means many doctors take a it can't hurt approach in their recommendations. When it comes to chondroitin sulfate, researchers are cautiously optimistic, and in the European Union, it is already considered a slow-acting drug. With the pharmaceutical-grade chondroitin sulfate on the market in the EU as a drug, it has the potential to one day be studied under the same parameters here. One day, it may have the potential to reduce the need for NSAIDs in the management of joint pain. Rather than use up the rest of our time on chondroitin sulfate, we suggest taking a look at some of our past blogs and vlogs focusing solely on chondroitin sulfate. Supplement number 4, methyl sulfonyl methane. The next supplement we want to talk about is methyl sulfonyl methane, otherwise referred to as MSM. This one is both a mouthful to say and a cramp-including nightmare to spell repeatedly. So we'll be calling it by its commonly used abbreviation MSM throughout the discussion instead. MSM is a small and naturally occurring organosulfur compound which can be formed naturally in the Earth's sulfur cycle. Since naturally occurring levels of MSM in things like fruits, vegetables, grains, and milk are fairly low, commercially available MSM is made in a reaction that mimics the atmospheric process in which it creates an MSM molecule identical to those found in nature. MSM is often taken either orally or topically as a supplement to help deal with osteoarthritis symptoms such as inflammation. Interestingly, it is also being investigated for use for scars, wrinkles, sunburn, and rosacea. Like many supplements, MSM requires further investigation before any hard answers can be given on efficacy. But we do know that in appropriate dosages, it is safe to take. Be sure to come back tomorrow as we finish things up by discussing supplement number 5, turmeric. Welcome back to part 4 of our Synutra Pure Vlog series, 5 Joint Health Supplements. Today we'll be covering supplement number 5, turmeric. The last supplement we'll be talking about is turmeric and its active compound curcumin, which are often investigated for their potential anti-inflammatory properties. In a study in Thailand looking at 367 patients with knee osteoarthritis, starting at a typical pain level of 5 out of 10, by the American College of Rheumatology criteria, randomized the group to receive either 1,200 milligrams per day of ibuprofen or 1,500 milligrams per day of turmeric extract in divided doses over a period of 4 weeks. Outcomes were evaluated on Western Ontario and McMaster University's Osteoarthritis Index, scores ranging from 0 to 10 at 2 weeks and 4 weeks by a blinded assessor, where at the 4-week mark, the mean total for the WOMAC scores of both groups, ibuprofen or turmeric, were within 0.5 points, indicating results were non-inferior for the turmeric extract group in comparison to the ibuprofen group. In another study, a systematic review and meta-analysis was done of randomized clinical trials on the efficacy of turmeric extracts and curcumin for alleviating the symptoms of joint arthritis. After an initial result of 10,293 articles and papers, the study eliminated hundreds of studies from qualifying for the review before finally coming up with 8 that met the required standard. After the systematic review and meta-analysis of these studies, it was found that, quote, scientific evidence that 8 to 12 weeks of standardized turmeric extracts, typically 1,000 milligrams per day of curcumin, treatment can reduce arthritis symptoms, mainly pain and inflammation-related symptoms, and results in similar improvements of the symptoms as ibuprofen and diclofenac sodium. While further research is needed, there are some positive results in curcumin's favor. Turmeric was the last of our 5 supplements, and that brings our conversation to a close this week. Talking about supplements is always a tricky conversation to have, as we understand better than most. That doesn't mean that it isn't a conversation worth having, though, as there is plenty of good information out there if you know what to look for and can sort out the good from the bad. Many supplements can only ever be recommendations or suggestions, as in most cases, further research is needed for many to be able to give hard answers on what they bring to the table. In the end, though, we hope that our coverage is informative and helpful and provide food for thought for conversations with your medical professional of choice. As always, this information is not intended to diagnose or treat any illness or disease. No information in any of our vlogs should ever be used as a substitute for medical advice from your doctor or another qualified medical professional.